Hello and welcome to part 2 of our lesson on systemic challenges within the U.S. healthcare system in the 21st century. Part 1 of this lesson focused on the legacy of segregation, socioeconomic factors, and how the COVID-19 pandemic highlighted the glaring racial disparities of care in the United States. In this lesson, we will discuss contemporary measures taken to improve our healthcare system. In addition, we will explore potential strategies for systemic change and how to improve access to quality healthcare. To understand the current systemic challenges within the U.S. healthcare system, we must first acknowledge its historical roots. The system's foundations were established during a time when inequalities were deeply ingrained in American society. Segregation and socioeconomic advantage influenced the developing healthcare systems in the 20th century. These narratives favored those in power. Think about the wheel of power and privilege we explored earlier in the course. Recall that those with the least amount of power are marginalized the most in our society. Historically, and even today, this influence extends into all aspects of the medical care industries, including training and testing. Imagine never having a doctor that looked like you or understood your needs. How might this feel? Hold on to that thought for now. It will come in handy later in this lesson. In the early 20th century, the Flexner Report promoted the standardization of medical education. While it improved the quality of healthcare, it also reinforced racial and gender biases in medical training. This severely limited opportunities for women and people of color to enter the medical field, which led to an industry filled largely with white men. Both implicit and explicit biases became ingrained in doctor training and care. Women and people of color experienced discrimination, and in some instances, irreparable damage. In addition to the lack of diversity within the medical field in general, dominant narratives around race and gender had a detrimental impact on medical testing. Let's take a look at an example from 1932, when the United States Public Health Service carried out the infamous Tuskegee syphilis study. This study, spanning decades, subjected African American men to untreated syphilis, all in the name of studying the disease's progression. This egregious study shines a light on systemic racism in healthcare, causing irreparable harm and sowing mistrust of the system within African American communities. Here's another shocking example: the forced sterilization of tens of thousands of people in the early to mid-20th century. These sterilization programs were designed to prevent individuals deemed mentally unfit by those in power from having children. While accurate numbers are hard to come by, it's estimated that at least 80,000 compulsory sterilizations took place between the late 1960s and 1970s. Notably, women of color were overwhelmingly targeted in these coerced sterilizations. African American women, especially in the South, bore the brunt of these forced sterilizations, often with little to no knowledge of what had been done to them. During the 1950s and 1960s, Black women going to the hospital for childbirth or other medical procedures discovered they could no longer have children due to unnecessary hysterectomies. This procedure, often termed as a Mississippi appendectomy, was primarily carried out by medical students without the patient's consent. African American women were not alone. Puerto Rican women became test subjects for new contraceptives, like the pill in the 1950s. Latina and Chicana women were the target demographic for California's sterilization program, which by 1964 had the most sterilizations of any state. In addition, an estimated 40% of Native Americans underwent sterilization procedures during the 1970s. Studies found that women were not given full explanations of the irreversibility of such procedures, nor alternative contraceptive options. Women of color who experienced these coerced procedures were overwhelmingly poor, and in many instances purposefully uninformed. These heinous examples of unethical medical experimentation underscore the fear communities of color have had and may continue to have towards the healthcare system. Medical training is integral to how doctors approach their patients. While the field has evolved since the Flexner Report, eliminating bias and building trust continue to be areas of growth. One example where this is evident is in doctor-patient relationships. Studies reveal that patients of color are often treated differently by healthcare providers, receiving less pain management, fewer referrals, and lower quality care. When asked how often they experience discrimination or prejudice in their healthcare encounters, communities of color reported a more substantial rate compared to their white counterparts, as shown in this 2020 data graph. This is further compounded when considering gender. African American women, for instance, may experience bias due to the intersectionality of their race and gender. In order to really understand the ways in which we may address systemic challenges within the healthcare system, it's important to consider the non-medical factors that impact people's health outcomes. The quality of one's health is often shaped by living conditions and opportunities, which are influenced by systemic factors. These are known as social determinants of health and are the wider set of forces and systems shaping the conditions of daily life. Social determinants like these, such as income, education, healthcare, housing, and community, have a profound influence on health. When we take social determinants into account, we see how these multiple systems interact and impact one another. Lack of access to any one of these factors can have an effect on a person's overall health and well-being. Healthcare providers are increasingly recognizing the importance of addressing social determinants when delivering care. However, addressing the impact of these systemic challenges requires broader societal changes. So, how else can we address these systemic challenges and work towards a more equitable healthcare system? Policymakers play a significant role in shaping healthcare policies. Advocacy for reforms that prioritize equitable access, quality, and outcomes is critical. Creating avenues for community partnerships to address pressing needs and more actively contribute to shaping policies is equally vital. In tandem with policymakers, voters must look for legislation they can support to pass laws or elect officials upholding these policies. Community health initiatives, like community clinics and outreach programs, can help bridge gaps in care and provide support to underserved populations. Healthcare facilities that actively engage with and hire from underserved communities can enhance trust and more effectively address community needs. Boosting the presence of individuals from marginalized backgrounds in medical schools and healthcare professions is key to tackling healthcare disparities. Diversifying the healthcare workforce corrects historical wrongs in medical training and testing, fostering trust within communities of color and among women who've endured the horrors of medical testing. It also expands access to education, economic opportunities, and amplifies voices in patient care. Initiating workforce diversity begins with addressing educational disparities, showing how these systems are interconnected. At the beginning of this lesson, we asked you to think about how it might feel to never have a doctor or nurse that looked like you. Now, I want you to imagine what it might look like to have a doctor or nurse that does look like you and understands your needs. Does it feel differently? What changes would you propose to make our healthcare system better in the future? Be sure to write your ideas down for future assignments. Achieving a more equitable healthcare system requires collaborative efforts from policymakers, healthcare providers, and communities, addressing the root causes of disparities and other related systems, and working towards a healthier, more just society. Thank you for watching.